An update on the city's Human Needs Task Force. Nous sommes ici aujourd'hui pour donner une mise à jour sur le groupe de travail sur les besoins humains. My name is Kina Leclerc. I will be your moderator. Je serai la modératrice aujourd'hui. As usual, before we begin, I just want to go over a few items. A reminder to place your mic on mute, until I invite you to ask your question. To view the city official who's speaking on Zoom, please put your view on speaker instead of gallery. The button for this is located at the top right corner. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Today we will be hearing remarks from Mayor Le Maire Jim Watson, followed by Councillor Jenna Sudds, Chair of the Community and Protective Services Committee, Présidente du Comité des services communautaires et de protection. Available for questions from the media following the statements, we also have, disponible pour des questions des médias, nous avons ici Anthony DiMonte, General Manager, Emergency and Protective Services Department, Directeur Général, Services de protection et d'urgence, Donna Gray, General Manager, Community and Social Services Department, Services sociaux et communautaires, Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, Clara Fieri, Director, Employment and Social Services, Directrice des services sociaux et d'emploi, Shelley Van Buskirk, Director, Housing, Directrice de logement, and Dean Lett, Director, Long-Term Care, Directeur, Soins de longue durée. After we hear from the panelists, we will take questions from the media. We will be going by alphabetical order by media outlet. Each outlet may ask one question and one follow-up, and this time you will be going from the bottom down to the top, so we will be beginning with media. We will now be hearing from Mayor Jim Watson. Merci.
Thank you, and good afternoon, everyone. Bon après-midi, mesdames et messieurs. I want to thank my council colleagues, city staff, media, and residents for joining us for today's announcement. Before we begin the formal portion, I would like to take a moment to reflect on yesterday's tragic events in Nova Scotia. I've asked that all flags at City Hall be lowered to half-mast in solidarity with the people of Nova Scotia. Tous les drapeaux à l'hôtel de ville sont en berne en solidarité avec la population de Nouvelle-Écosse à la suite des événements tragiques d'hier. In addition, prior to the council meeting on Wednesday, we'll hold a moment of silence in honor and respect of the victims of this violence. Our thoughts are obviously with the victims' families and friends as they deal with this incomprehensible act of violence. Today, I want to thank Councillor Jenna Sudds for joining us. She is the chair of the Community and Protective Services Committee, and all of our staff will work very hard on the Human Needs Task Force. As you know, we established two task forces, one on economic recovery and the other on human needs. And we've been working collaboratively with the provincial and federal government, who are providing significant funding to help during this crisis. The province of Ontario, for instance, has announced that it is providing funding to municipalities and organizations that administer social services through the Social Services Relief Fund in order to support them in the response to COVID-19. The city has received $6.6 million of a $13.3 million commitment through the Provincial Community Homelessness Prevention Initiative. The city has also received $4.8 million through the federal government's Reaching Home program announced in late March. In total, we've received $11.4 million from our provincial and federal partners to help improve the capacity of homelessness service providers and other nonprofit social services to help clients immediately. $8.4 million of this funding will be allocated to the existing shelter system and the most pressing homelessness needs, including isolation centers, day services, and shelter services. The remaining $3 million of the funding will be allocated to the not-for-profit community organizations to address their persistent and immediate needs. We're inviting local established nonprofit agencies to apply for this funding. These agencies must focus specifically on serving individuals and families who are experiencing homelessness or at risk of homelessness, or who provide essential services and support to other at-risk residents and equity-seeking communities during the COVID-19 crisis. We will have two funding categories, one for homelessness service providers and residential services homes, and another for agencies providing, quote, essential services and supports for at-risk residents and equity-seeking communities with a focus on Indigenous communities and women who are among the most negatively affected by the current social isolation requirements. The applications for the funding will be open today and forms will be available at ottawa.ca. The deadline for applications will be the end of the day on April 27th. That's Monday, April 27th. We're aiming to distribute the funding to our partners in early May, with our partners being notified by Thursday, May 7th. I would like to thank the Government of Ontario and the Government of Canada for their support, which is enabling us to conduct the critical work necessary to support the residents in our community facing the greatest challenges. J'aimerais remercier la province de l'Ontario ainsi que le gouvernement du Canada pour leur soutien, ce qui nous permet de mener le travail essentiel nécessaire pour aider les résidents confrontés aux plus grands défis. I also want to take a moment to recognize the great work being done by the Human Needs Task Force. Je souhaite ainsi reconnaître les efforts du groupe de travail sur les besoins humains. In addition to facilitating funding, the task force has been doing critical work with our city's shelter system. Our family shelter system serves more than 500 families, but the shelters and traditional housing we rely on often have shared bathrooms and can have kitchens shared by up to 15 families, which is challenging when trying to follow physical distance guidelines. The city has been securing facilities outside of the current family shelter system to provide families with the space to practice safe physical distance. Working with a number of local hotels, we've already secured 70 hotel rooms for families and are working to acquire many more. We're also working to open the Jim Durrell Recreation Center the week of April 27th to provide immediate physical distancing space for the men's shelter system and recreation system with capacity to accommodate up to 140 men. In partnership with the Shepherds of Good Hope, the Royal Ottawa Hospital, and the Ministry of Health and Long-Term Care, and in collaboration with Inner City Health, the city will open a second isolation center. The center will be in Le Patro d'Ottawa Recreation Center in Lower Town. It will open the week of April 27th and have space to accommodate 40 individuals. The center will support residential services homes and the Provincial Homes for Special Care program. It will serve individuals who tested positive for COVID-19 or have mild symptoms or have been in direct contact with individuals who in fact did test positive. In addition, we're in the process of securing up to 50 hotel rooms for single women and youth to reduce capacity at the emergency shelter center. The closing of many services due to COVID-19 has meant that access to public toilets that many of us, including many homeless or vulnerable residents, relied on has been severely curtailed. For homeless residents, access to shower facilities is a growing need. The Human Needs Task Force is addressing this issue by working with day programs and other community services on plans to reopen a portion of these services while respecting OPH guidelines. In the interim, the city will temporarily open the McNabb Community Center in the coming week. It will offer basic washroom and shower facilities addressing the needs of many community members. In addition, the team is in the process of sourcing and finding convenient locations for more portable toilets and showers. The task force is also looking at how to proactively and effectively support the mental health of our vulnerable residents. And with many social service agencies indicating a significant need for personal protective equipment, the task force will turn its attention to work with the Office of Emergency Management to source a supply for PPE. These are difficult times for all of us. The lack of regular social contact can be mentally straining. The Human Needs Task Force has made it a priority to reach out to our most vulnerable residents who are experiencing social isolation. The initial focus has been addressing on the immediate needs of our most vulnerable residents, particularly seniors in rural and urban settings. For rural seniors, we will be mailing out tailored information postcards that will be distributed throughout West Carleton March, Cumberland, Osgood, and Rideau Woburn wards. These postcards include information about how to reach the ward counselors, as well as how to access important food resources and community supports in their areas. Ces cartes postales comprennent des informations sur comment rejoindre leur conseiller local, ainsi que sur la façon d'accéder à d'importantes ressources alimentaires et communautaires dans les régions. This initial outreach will be followed up by phone calls and visits where necessary. And Ottawa Community Housing has completed more than 1,400 check-in phone calls to residents on their emergency list and are now focusing on checking calls to the most vulnerable of their 6,300 seniors. In addition, the Red Cross, who is a member of the task force, will start conducting in-person wellness checks on Tuesday to about 200 OCH residents who could not be reached by phone. We realize that food security is also an issue for some residents. And the task force has been working hard to identify needs within Ottawa's food network and develop a coordinated approach to address these concerns and these needs. The task force has created an exhaustive fact sheet about food resources in the city to provide residents with information on key pickup and delivery options within their communities. The fact sheet is available on ottawa.ca and is being distributed to community agencies. And the fact sheet will be translated into 6 languages in addition to English and French and provided to all members of council. Finally, I want to thank everyone working on the Human Needs Task Force under the guidance of Chair Suds and Donna Gray, General Manager of the city's Community and Social Services Department, as well as our many partners who have come to the table in the spirit of goodwill, try to help as best we can some of the most vulnerable people in our community. They've done exceptional work in a very short period of time, but we know there's more work to do. And I'll ask Chair Suds to offer her perspective. Thank you. Merci.
Excellent. Thank you very much, Mayor Watson, and good afternoon, everyone. Bon après-midi, tout le monde. As chair of the city's Community and Protective Services Committee, I am immensely proud of the work of the Human Needs Task Force, the work that they are doing to support residents in our community facing the greatest challenges and barriers during this difficult time. The task force brings together over 45 community partners and city staff across a number of departments, including Ottawa Public Health, to assess needs, collaborate to find solutions, and coordinate the delivery of the many services that people rely on. With the devastating impacts of this crisis, the needs are diverse and expansive, and we are committed to ensuring the most vulnerable residents are well supported during this pandemic. The Human Needs Task Force is working every day to provide the services and the resources that people need to stay healthy and to stay safe. Le groupe de travail sur les besoins humains travaille tous les jours afin de fournir des services et des ressources pour que les jeunes demeurent en santé et en sécurité. The scope of work that we are able to accomplish is not possible without the tireless work of many community partners. Supports include outreach to rural and isolated seniors, food delivery to isolated residents, facilitating transportation to medical appointments and the delivery of prescriptions, and providing kind words and phone supports and other resources, as well as coordinating volunteers. Funding is also, of course, a big part of this support, the puzzle. And the community funding team, as part of the Human Needs Task Force, is working closely with both the United Way and the Community Foundation to support nonprofit agencies to help with urgent and unforeseen needs. One of the most critical areas in the COVID-19 pandemic response is working with our partners to address the many housing and homeless needs. I want to thank Mayor Watson for his tireless work during this crisis and for highlighting the importance of the work we are doing in the city's shelter system to protect the homeless from COVID-19. The social services relief funding announced by the provincial government will be directed to meet the growing needs of the shelter system in Ottawa. A portion of that funding will assist local nonprofit social service agencies and residential service home operators. The confirmed COVID-19 cases at the YMCA in Ottawa underscores the investment that we need to make and the work that we need to continue doing to protect people and to limit the spread. There have been 3 confirmed COVID-19 cases in our entire shelter system in Ottawa to date. Overcrowding, coupled with a tendency for clients to congregate in shared facilities, increases the risk of the spread. Residential facilities are required to have isolation capacity on site as part of their pandemic plans, but we know that the need is increasing. The Human Needs Task Force has been working to further limit that risk by setting up a 40-bed isolation and treatment center for those in the shelter system who are displaying symptoms or who have tested positive. In partnership with Ottawa Inner City Health, the Routier Community Center was set up to house vulnerable people who would otherwise have nowhere else to go safely to be in isolation. The number of people using this facility does fluctuate, but there are currently 11 individuals using this center. For families in the shelter system who have symptoms or have tested positive, the city has secured a building from the University of Ottawa for up to 21 families, as well as a second 28-unit building from a hotel provider. There are currently 4 families from the YMCA self-isolating at the facility set up. And a key focus now is providing suitable accommodations where individuals and families can practice physical distancing to prevent the spread of the virus. These families are provided personal needs supports, including food and wellness checks that are conducted by a team of housing caseworkers and community agencies. There are youth as well in Ottawa living in emergency shelters and transitional housing and other residential settings where the ability to self-isolate is also limited. The Youth Services Bureau has been working with CHIO to set up isolation space for youth between the ages of 16 and 18. Helping the most vulnerable is a momentous undertaking. And I want to thank the volunteers and the community partners who are working with the city to protect the health, safety, and well-being of people in need. Ottawa is an incredibly kind and caring community, and I want to encourage people to donate where they can to local food banks and to support local charities if you're able to. The Human Needs Task Force includes partners from all sectors, and I want residents to know about the important contributions of these many agencies that are involved, including 211, United Way Eastern Ontario, the Coalition of Community Health and Resource Centers of Ottawa, Ottawa Community Housing, the Ottawa Food Bank, the Good Companions, the Champlain Community Support Network, Canadian Red Cross, the Salvation Army, Ottawa Inner City Health, the Ottawa Aboriginal Coalition, and the Canadian Mental Health Association. These agencies have expertise in a range of services, and I'd like to take a moment to highlight some of the great work being done across the city. The Champlain Community Support Network has developed a website for seniors and adults with disabilities that make it easier to access services as well as public health and other resources. The Ottawa Food Bank continues to be a leader in helping address food insecurity and the needs of Ottawa's most vulnerable populations. And local food banks are doing everything they can to improve access to food for people in need. As of today, the Ottawa Food Bank expects to have distributed $550,000 worth of grocery store gift cards to food banks across Ottawa for those in need. Working with the Ottawa Food Bank, the Human Needs Task Force has established a food security subgroup to identify the ongoing needs within Ottawa's food network and coordinate approaches to address these needs. These partners include Ottawa Food Bank, Project Ramsay, Meals on Wheels, Montfort Renaissance, and the Champlain Community Support Network. And Volunteer Ottawa as well, along with the Champlain Community Support Network, have enhanced platforms to recruit, to train, and deploy volunteers to meet a diverse range of needs across the city. We are taking these measures in order to protect some of our most vulnerable residents. And I know that there's a lot of anxiety in our city and our community over how best to cope with the circumstances brought on by COVID-19. I am immensely proud of the work, the city's work on the Human Needs Task Force, and proud of the countless community partners that have stepped up to provide supports for those in our community that need it most. Je suis fière du travail accompli par le groupe de travail sur les besoins humains et des efforts continus de nos partenaires communautaires. Thank you. Merci beaucoup.
Thank you, Mayor Watson and Chair Suds. I'll quickly do a roll call to see which agencies are on the line. If I have missed anyone, please let me know. Je vais confirmer les noms des médias qui sont en attente. 1310 News, Chris Curries.
Here.
Thanks, Chris. Laura Osman at Canadian Press.
Here.
Thank you. Kate Porter at CBC.
Here.
Thank you. Josh Pringle at CTV.
Here.
Thank you. Julien Paquette, Le Droit.
Ici.
Merci. Fred Sherwin at Orleans Star.
Here.
Thanks. John Willing at Ottawa Citizen.
Hi, Kina.
Hi. Pat Ugochioni, Ottawa Community Voice.
Yeah, I'm here. Thanks.
Thank you. Blair Crawford at Ottawa Sun.
I'm here.
Thanks, Blair. Pascal-Marie Dufour, Radio-Canada.
Je suis là.
Merci. Gavin Lumsden, Rogers. Kenza Beladi, TVA.
Présente.
OK. Merci à tous. Have I missed anybody? Est-ce que j'ai manqué quelqu'un? Okay. Again, a reminder to remain on mute until I invite you to ask your question. I will now invite each agency. I will be going, like I said, from the bottom up. You may ask one question with a follow-up. Nous allons maintenant répondre aux questions des médias qui pourront poser une question et une de suivi. So we'll now start with TVA. Kenza, es-tu prête?
Oui, est-ce que vous m'entendez bien?
Oui.
Parfait. Donc, moi, c'est évidemment sur le groupe de travail sur les besoins humains. Je veux juste comprendre bien en français l'importance de mettre en place toutes les mesures que vous avez nommées un peu plus tôt. Là. On parle de financement, on parle de plusieurs mesures. Là. Quelle est l'importance en cette période de crise? Monsieur Watson, si vous pouvez répondre.
Oui, j'ai entendu beaucoup de monde sur la ligne. Est-ce que c'est possible de répéter la question parce qu'il y a 2, 3 autres personnes?
Est-ce que vous m'entendez, là? Est-ce que vous m'entendez?
Oui, 3, oui, mais c'est nécessaire pour les autres de mettre sur mute. Bon, allez-y. Pas toi.
Allô, est-ce que vous m'entendez mieux?
Oui, maintenant. Bon.
Super. Donc, de nous rappeler l'importance en français des mesures qui ont été mises en place là, par le groupe de travail sur les besoins humains. Là, faire un petit peu le bilan, là, mais en français, de ce que vous avez dit un peu plus tôt.
Oui, écoutez, c'est vraiment une chose très importante pour nous autres. Ça, c'est la raison qu'on a créé les deux groupes économiques et un autre groupe pour des personnes avec des besoins, des sans-abri, par exemple. Alors, ça, c'est un bon partenariat entre le secteur communautaire, comme Jenna a mentionné, mais aussi avec l'appui du gouvernement de l'Ontario et du Canada pour fournir l'argent pour louer les chambres de l'hôtel, pour aider les familles qui ont besoin d'un taux. Et certainement, on va continuer de travailler avec des personnes dans cette catégorie de sans-abri parce que, par exemple, il n'y a pas beaucoup de place pour des personnes de visiter une salle de bain parce que presque tous les restaurants sont fermés. Alors, ça, c'est la raison qu'on va commencer un service pour le sans-abri à le centre communautaire dans le centre-ville. Alors, je suis très fier des activités dans ce secteur. Il n'y a pas beaucoup de publicité pour cette moitié de la communauté, mais c'est vraiment une priorité pour moi personnellement, Jenna et tout le personnel à la Ville d'Ottawa d'aider des personnes les plus vulnérables dans notre communauté.
Merci beaucoup.
Avez-vous une autre question, Kenza?
Oui, moi, c'est par rapport à un autre sujet, M. Watson, encore une fois, pour vous. Là, je veux juste avoir quelques mots de votre part, votre réaction en lien avec la tragédie qui est survenue en Nouvelle-Écosse. Et là,
Oui,
vous avez les drapeaux à Berne.
Oui, c'est vraiment une tragédie. C'est une tragédie non seulement pour la province de Nouvelle-Écosse, mais certainement pour tout le pays. Ça, c'est la raison que pendant la réunion du Conseil, on donnait une minute de silence en respect de les personnes qui ont perdu leur vie. C'est la plus grande tragédie, malheureusement, dans l'histoire de notre ville, le numéro de personnes qui ont perdu leur vie. Et nos prières et avec les familles des victimes et des amis, et certainement aussi à la GRC parce qu'il a perdu un membre de la GRC aussi.
Merci beaucoup. Alors, Pascal-Marie Dufour, Radio-Canada.
Oui, vous m'entendez?
Oui.
Parfait. J'aimerais savoir, la province a dit, bon, le pic semble passer maintenant, le pic de la COVID. J'aimerais savoir la situation dans la région. Ici, à Ottawa, est-ce qu'on a l'impression que le pic est atteint? Et deuxième question, j'aimerais savoir aussi qu'est-ce qu'on va faire, qu'est-ce que l'on peut faire de plus pour aider, pour empêcher la propagation de la COVID dans les foyers pour personnes âgées qui sont les plus vulnérables?
Pascal, votre question. Oh, Dr. Etches, sorry, your video is on mute. I'll just unmute you. There we go.
Est-ce que quelqu'un peut m'entendre?
Oui, là, on vous
Oui?
entend.
OK. Je n'ai pas la capacité d'entendre et parler en même fois. Alors, juste... Oui. OK. Je voudrais donner une réponse concernant la situation avec les infections dans notre communauté. Nous n'avons pas encore une augmentation dans le nombre de cas confirmés parce que c'est le cas que nous avons des dépistages qui continuent. Alors aussi, il y a un grand nombre de cas maintenant dans notre maison de soins de longue durée. Alors, la bonne nouvelle est que les hospitalisations sont presque plates et ça donne une idée que oui, nous sommes dans une période où on peut peut-être voir une diminution dans les infections dans notre communauté. Alors, c'est similaire que la province, le courbe dans la province. D'autres questions, c'est concernant les centres de longue durée. Et oui, il y a une grande initiative avec les hôpitaux d'aider les centres avec d'autres employés, d'autres équipements pour la protection des travailleurs. Aussi, Santé publique aide avec les éclosions et d'augmenter le nombre de personnes qui un dépistage s'il y a des symptômes d'infection avec COVID-19. Alors, c'est vraiment une priorité maintenant pour tout le système de la santé à Ottawa et dans la province.
Merci.
Merci beaucoup. Alors, Blair Crawford, Ottawa Sun.
Yes, hello. I think Councillor Sudds had mentioned the 3 cases in the homeless shelter system. And I'm wondering if you could describe how you're testing, whether everyone's being tested in the homeless center, if you're reaching everyone. And maybe I'll just ask my follow-up question now would be, are there any more details about the 3 cases, ages, sex, and so on?
Thank you for the question. And I think I would probably point this to Donna as far as what's happening as far as the confirmed cases. Or perhaps Dr. Etches.
M'excuse, c'est mauvais. Je pense que probablement les gens veulent que je réponde un peu. Sorry, I'm gonna answer the. You have to give me head nods. I need verbal. Thank you. That's great. Okay. So there was a question about 3 cases in the shelters, and I don't have more details on those cases. It's like cases anywhere. We're not sharing a lot of information in terms of protecting people's privacy. But the situation is that we're on the lookout for cases. There's active surveillance by people who work in the shelters to identify anybody who might be showing signs of a COVID infection. And then we do the same thing we do in every situation. We look for the close contacts of anybody around that case so that we can make sure that we follow up with somebody who might be incubating the infection, and also ask them to self-isolate and create the possibility for them to self-isolate, like was described. That sometimes means that people need different, to go to a different location for housing.
Thank you. All right, now we'll move on to Pat Ugoccioni, Ottawa Community Voice.
Yeah, my question is for Dr. Etches. Today, the province said that Ontario has reached its peak. I wonder if you could speak to the numbers in Ottawa, if that's the case in Ottawa as well.
Sorry, Dr. Etches, we can't hear you.
I'm not sure why you. Okay. It's a challenge. I'm not sure why. Sorry. Just in terms of the question was the peak. We don't have a lot of evidence for a peak yet in Ottawa because our case numbers continue to go up. But we do have evidence of a similar picture to Ontario in that the hospitalizations are stable and the number of people being admitted to the intensive care unit is stable. And so that shows us really the underlying burden of infection in the community is probably stable, because the proportion that gets severe illness is showing up. The number of tests keeps going up, but because we're testing more people, and so that's not going to show the same kind of peak. I think the hospitalizations are worth following, and I am hopeful that will show a decline, reflecting an overall decline in the infections in our community in the days to come.
Thank you. And do you have a follow-up, Pat?
Yeah, over the weekend, the Queens Bay Carleton Hospital announced that it's going to be opening up 16 beds at a closed Canada hotel. They didn't have any time frame for that. I'm wondering if you could speak more about that, if you had any more information as to what this ward is, and is it really just freeing up space for the hospital for this peak that we may get?
I don't have any more information.
Sorry. Thank you.
There's a lag. I think there's a lag from when you can hear me. I don't have any more information on the Queens Bay Carleton specific plans. The healthcare system as a whole, is operating, trying to create new options for people who maybe don't need to be in hospital or who need a different level of care. So I think that question could be directed to them specifically.
Thank you very much. Okay, so now we'll go to John Willing at Ottawa Citizen.
Hi, it's a question for Dean Lett on the line. I'm wondering if the long-term care branch has learned how many staff they have or have not lost because of the one workplace policy.
Hi, John. At this time, we don't have the exact number. We're still working through that as we determine how many staff we will have at each location and which specific discipline we'll have available. I was hoping to have had that on the weekend, but I don't have those numbers as of now.
Thank you. Do you have a follow-up, John?
Yeah, follow up. Just, I guess, I don't know if anyone from Public Works is on the line, but maybe to Mayor Watson. I know there's been a bit of a lag in some areas on garbage collection today. I think just a day, but I wonder if this is a systemic problem or a problem with the contractor with regards to COVID, or if we're going to see that kind of trend in future weeks as well.
Yeah, I just got a note on that, John. I don't know, Tony, do you have anything else to comment? Because I know it's COVID-D related, COVID-19.
Yeah, Mayor, we have one of our city contractors, Miller Waste Ottawa, that one of their staff was COVID positive, and they've been working with Ottawa Public Health. So there's going to be a one-day delay while they validate with all their staff and coordinate to ensure there's no other issues, and we'll pick that up right afterwards. And Dr. Etchers and her team are working with them to do that. So John, there'll probably be a one-day delay in certain areas of the city, and those councillors have been advised of where that is. It's zones 2 and 4, and if you ask me where that is, I'm sorry, I'm not able to give you that.
We can also follow. Sorry.
Well, yeah, I was just going to say that this is COVID-D or COVID-19 related, as opposed to the issue we had a little while ago with waste management, where it was just they were not complying with the contract and they were behind because they'd lost a number of trucks in a fire, I believe.
Thank you, Mr. Mayor. We can also follow up with you, John, at Media Relations. So we'll move on to Fred Sherwin at Orleans Star.
Yes, Dr. Etchers, could you quantify how many tests the city is capable of doing, like this week, for instance, and how do you see that ramping up in terms of numbers? What you see happening over the next couple of weeks?
So in the city of Ottawa, the two are about 800 tests a day, and I understand that there'll probably be up to 1,000 tests next week. We are getting closer to using that capacity, we're getting closer to the 800 being actually done each day, and I hope that we'll continue to use that capacity as it continues to grow. No one has said stop growing your capacity. So our desire is to continue to grow that capacity indefinitely until we can test anybody who has symptoms as one of the strategies to be more targeted in how we contain this infection. It hasn't been necessary in the early stages of the pandemic to contain the pandemic by testing everybody, because our advice is the same whether you're tested or not. If you have symptoms, to stay home and don't spread it. But as we go into a next phase of pandemic, then that case finding is more important. So that's why we're speaking about continuing to continuously increase our capacity.
What are the limitations then to testing? I mean, are you competing with other municipalities in terms of the number of swabs and kits you get, or are those ordered provincially or from or is the limitation places that you can actually carry out the testing?
If your question limitation, like what are the and many the competition, if you want to phrase it that way, the supply of swabs seems to have been addressed in that there is no particular barrier right now around swab supply. That's what the province is communicating, and it seems to be real. On the ground, there's enough swabs. The challenges still relate to some of the chemical reagents that are used to process the tests. So I've been told even like part of the contents of the reagent that's needed is silica. So just even having enough silica in the worldwide to be able to have enough reagent to do the test. And then it requires trained laboratory personnel. These are not simple tests. People have heard about things that could be done in an hour. These tests actually require, people who know how to do the procedure properly. And so there's the training of the personnel and the addition of labs that's required.
Hello, hi, it's Ian. I'm just going to take over for Kina on moderating. Just having some issues, and that was, we're going to go now to le droit. Julien Paquette, sur la ligne?
Oui, bonjour. Je ne sais pas si M. le maire est encore présent.
Non, excusez-moi, le maire a dû quitter. Il y a une alarme d'incendie à l'hôtel de ville. Donc,
OK.
on a une évacuation en cours. On ne sait pas s'il y a quoi que ce soit.
D'accord. Bon, on va espérer que ce ne soit pas trop grave. Je ne sais pas si... maybe I'll ask in English, so I don't know who's going to be able to answer to that. But I was wondering, how did the COVID-19 change the dynamic in the shelter network so that we needed more capacity, as we announced today, with the funding from provincial and federal governments?
I'm happy to start, and then maybe someone on the line would like to add. But I think the obvious is the need for physical distancing. So the ability within the shelter system to be able to create that space, that physical distancing, does mean that we need to leverage other locations, as have been mentioned, whether it's hotels or looking at, mentioned the Jim Dorrell Recreation Center, so that those that are using the system can have that space to stop the spread.
Parfait, merci. Thank you. And my follow-up would be just to clarify, is the fact that we have only 3 confirmed cases in the shelter system, is it more a reflection of the fact that the measures in place are effective, or is it due to the fact that it's harder to get testing to these individuals?
I see Dr. Etches has stepped away, and I don't want to necessarily enter into her realm of expertise, but certainly the probability of people being in close contact like that. Oh, she's back. Perhaps Dr. Etches, I don't know if you heard that question, or do you want to repeat it?
We're working with making sure that any... Can you hear me now? Yeah. We're working with our healthcare partners to make sure anybody who needs to be tested for COVID-19 in a congregate setting, like a shelter, is able to be tested. And, we have really strong healthcare partners in our healthcare system here in Ottawa. Inner City Health is playing a lead role. So I don't expect there are barriers for people who need to be tested for COVID-19. That is something that is being supported for the workers in these settings as well. The workers are a priority for COVID-19 testing if they have any symptoms of respiratory illness. So, no, I think it is a picture we're going to keep watching. But, one of the first things that was set up in the city was the isolation center at Routier for the homeless population. So I do want to thank, the city for making this a priority.
For our next question, we'll go to Josh Pringle at CTV.
Thank you very much. Just to follow up, Dr. Etches, do you have any plans right now to test everybody in the homeless shelter system to make sure that they don't have COVID-19? Is that something that you can do, something you've thought about just to limit the spread?
Sorry for this, everyone. Sorry. The question was whether we've thought about or will test everyone in the homeless shelters. And the answer is we've thought about it in terms of, the question comes up just like you've asked it. People are wondering, would that be a good strategy? It really wouldn't be recommended because what's most important to stop the spread of the infection is good infection prevention and control measures. So making sure people are able to wash their hands, making sure people are able to physically distance from each other, making sure that when people do develop symptoms, they are able to be assessed. If we tested everybody, it's only a picture of one point in time, and it doesn't change how you need to treat each other, which is that you're potentially a source of infection, whoever you come into contact with. It doesn't change the management, and it can give a false sense of security that, oh, that person was negative, so I'm going to hang out with them or whatever. It just doesn't, it's not good to have that kind of easing up and sense of, security that nobody tested positive at this point in time. In fact, you'd have to keep repeating the test all the time because people could be incubating, they might become positive the next day, the test doesn't pick up illness in the early stages. So there's a lot of challenge around just thinking that testing everybody is the solution. It's not. And so it's really these other things that people have put in place to support people, to have more distance between each other, to be able to access, facilities for washing. These things are very important, and the province is on the same page with this. The province really does not recommend testing of asymptomatic people in almost every situation. It's just a few situations where we would test asymptomatic people in a setting of outbreak, where you're going to go to healthcare workers or the workers of that facility who might be asymptomatic because of the importance of their interaction with residents that are vulnerable. And you might go to the close contacts of a case in a congregate setting where there's asymptomatic close contacts. You might test people who are asymptomatic in that case, but that's it.
And my follow-up for Dr. Etches as well. You said that there's no evidence right now of a peak of cases in Ottawa. Are people getting too far ahead of themselves when they start even thinking about lifting some of these restrictions? Like, are we still 2 months away from even this talk being a reality right now? Do you have any guidelines on that?
My computer froze. Would you like me to continue? Give me a thumbs up, please. Thank you. Okay. So I didn't say we see a peak in the laboratory confirmed tests because we don't. They're still going up. What I said is hopeful. So it's reasonable to have the conversation about how do we collectively, with the federal government, the provincial government, locally, start to think about the best way to safely ease up some of the restrictions, is that our hospitalizations and our intensive care unit visits are stable, and we're hoping they'll be in a decline. So it's never too early to start to have a good plan and a coordinated plan to think about how we get out of some of these restrictions safely. So I'm not going to say it's going to be months. I'm going to say that we want to start planning now, and we want to do it in a coordinated way across all levels of government. And this is a conversation that has room for community input. So, I've been talking to the city about how we're going to go about collectively understanding the wishes of our community also, and where there's room to do that, to build in priorities of our community, that we might be able to take a look at doing that. So hopefully that answers your question.
Thank you. We'll go now to Kate Porter at CBC.
Hi there. I was wondering, did I hear properly that it was 3 cases in shelters? Were they all at the Y? But also, is 3 sort of less than you might have expected to see in the shelter system, or still a concerning number? I'm not sure if that's for Dr. Etches or possibly Donna Gray, I'm not sure.
I was the one who said there were 3 cases. I'm not sure who spoke to in a congregate setting is a concern that it could lead to an outbreak, and so we're taking every case seriously. And I'm not sure whoever mentioned the 3 cases, if that relates to the why. I think that in fact that's being treated separately. The Y is being treated as the YMCA center, not treated in the count for the shelters.
And it's Donna. I can confirm that we have 4 families that are currently at the Ottawa U location, if we just talk about overall. And we have 2 individuals that are currently at Ruche that have tested positive.
Sorry, what is the number though then?
So the total number would be 4 families who have tested positive and 2 individuals for a total of 6.
Okay, great. Thank you. This is probably my follow-up is probably for you too, Ms. Gray. I was just wondering, because if all of these extra beds for the most part come online, something like 5-6 weeks after a lot of the changes first came about, I don't know, and we're talking about now possibly peaking. Are these coming? Could these not have come sooner, I guess is my question, because one would think then that people have been having to be in shelters closer together for what could have been the worst of it, right?
So our first response has really been about, as Dr. Vera Etches said, is really about safeguarding the existing shelter and enhancing their infection control processes and procedures. And you can see from that in the early days that they've done, an outstanding job given the number of people that we currently have in our homeless population right now. The challenge that we've had in terms of opening additional centers, primarily we've been using hotels as a first state of social distancing. So we've moved a number of people into hotel rooms, which has been our first priority, to ensure that they have the ability to have a washroom and have some ability to isolate alone. The challenge has been for us that those hotel rooms have been diminishing. So as the hotel rooms have been diminishing, we've been looking at alternate sites and alternate ability to put people in more congregate living situations, which is a secondary response, which would be the gym dural. So we've been kind of balancing it based on needs. We know now in the social distancing that not just hotels, we need to do another center, and that's why that's come online now to really address the social distancing. We have immediately addressed the social distancing in our family shelters, which again was part of our priority because of the vulnerability and the number of people that we have in those very crowded situations.
That's helpful. Thank you.
Right, and now to Laura Osman at Canadian Press.
Hey there. I think this question might be for John as well, or perhaps Shelley. I was wondering what thought's been given to the Alliance to End Homelessness Ottawa's proposal to actually acquire hotels to try to leverage this immediate urgent funding for a long-term solution to the homelessness problem.
Thank you, Laura. I can take that. I think the hotel situation for us has been our first emergent need has been dealing with it, putting individual cases in there. We are realizing that as we look at hotels and we have more positive cases, that we are looking for our needs in hotel rooms because being greater because the hotel industry is less comfortable in terms of bringing in COVID positive individuals into their hotel rooms. We have had one organization reach out to us to consider leasing as an option to do that. And we are definitely looking at leasing hotel rooms in the short term to address our immediate response to COVID. But we are also thinking in the long term around, is there an ability to think about leasing or a lease buy option or a buy option in the longer term? Recognizing that buying a hotel at this point in time would be a significant investment for the city, and we need to do that in partnership with other levels of government, and would take us some time to buy, but definitely lease buy options or buy options for the future are definitely on the table for consideration. around the magnitude of the cost and then which provincial partners or federal partners we could bring to the table to support us.
That's great. And I understand the need to house people immediately and help them isolate. So I'm not being flippant when I ask what happens once this pandemic is over and you need to evict people from these hotel rooms and put them back into the shelters.
No, I think that that's a really good question. And as we're looking at solutions and as we're looking at options in the short term, we have to be thinking about that because, you know, as we resume business, we need to resume services in rec centers and we need to resume other activities across the city, including tourism. So we are and do now are turning our mind to what is the medium and long-term solution to make sure that we are creating a system in the shelter system that does have some capacity to reduce the overcrowding and support the physical distancing, which we believe is not here just for the short term.
And lastly, from 1310, we have Chris Curries.
Yes, hi, just making sure you hear me okay.
Yes, we can hear you.
Okay, perfect. So question to the mayor. The province has said that our community peak is here in the province. And, you know, the numbers are closer to our best case scenario. And many people are going to take that as a sign that they can start to stop physical distancing and kind of break the rules a bit as our weather gets a little bit nicer. Do you have a message for anyone thinking of doing anything like that?
Well, the message has been consistent. Please respect physical distancing and practice it because we're not through this, even though the province has indicated we may be at the peak, which is great news. There's still more and more people that are being announced as having COVID-19. So I think we don't want to let our guard down, number one. We have to be respectful of each other's space and keep 2 meters between one another. And at the end of the day, this is not going to be one day where everything gets back to normal. It's going to be very much a phased in, staged approach. So I would encourage people in Ottawa who have been great at social distancing, by and large, to please continue to do that. If I could just mention, you'll have a supplementary there, but the wards that are affected on the garbage issue are Councillor Brockington, Egli, Cloutier, and Menard. Those are the 4 wards that have garbage deferred by or delayed by 1 day.
Perfect. And just a follow up, could you provide a comment on the NCC opening up the Queen Elizabeth and some space on Bank Street opening up for people to be able to do a bit more physical distancing on the roads? This was the first weekend that it happened. How do you think it went?
Yeah, I really haven't seen a full report on it. I know we had some of our staff monitoring the situation. Certainly Sunday, obviously, were very few people because of very bad weather. In terms of physical distancing, you know, I'm hearing second and third hand that in some areas it worked well, in other areas people bulked together and it sort of defeated the purpose. So I think the whole purpose of the NCC doing this is to do it as a pilot to see if it works. But if it causes more, obviously, challenges with social distancing, then perhaps it won't be the success they'd hoped it was. But if they can keep people spread out and not bunched together, whether they're jogging or cycling, and keep the cyclists and the pedestrians out of each other's way, then I think that will be good news. But I haven't seen any analysis as to how it's worked. There was very little media coverage, I noticed, on the weekend about it as well.
Thank you.
All right. That's it for today. Merci beaucoup.
Right. Thank you.